So during the second trial of the 5 milliliter thin liquid is when we see most of Opie's swallowing issues occur. You can see Opie begin to drink the thin liquid, and there is some interlabial escape. However, a major concern is what happened next. The bolus transports down the posterior pharyngeal cavity and enters the vallecula. Once enough material is there, it begins to pull over to the piriform sinuses. At this point, the swallow still hasn't been triggered. This makes us think that Opie may be experiencing a sensory problem in the pharyngeal structures. It is also observed that the laryngeal vestibular closure is incomplete and the airway is being exposed, as well as a narrow column of contrast between the tongue base and pharyngeal wall. Due to the incomplete laryngeal vestibular closure, there was an occurrence of penetration and no effort was made to eject this material. These deficits are a concern to us. Now, during the cup-in thin trial, a much bigger sample of barium entered the airway and aspiration occurred. That is during this screenshot. And the material barium did travel all the way down. Once again, no cough reflex was present. So for this reason, we decided to not present the sequential cup-sip thin trial. And at this time, we decided to thicken the liquids to see if this eliminates the occurrence of penetration and or aspiration. As the swallow study continued, during the 5 milliliter of nectar trial, the initiation of swallows seemed to occur at a more appropriate time, and a second involuntary swallow occurred to dispose of the residue collection on the oral structures. Let me pull up the PowerPoint again. Yes. And we do see that during the 5 milliliter honey trial, there is a partial obstruction of flow surrounding the PES opening. However, overall, we saw improvement in the swallow when the materials were thickened, and there were no instances of either penetration and or aspiration once the material was thickened. After exploring the video fluoroscopy, it was determined that Opie scored an 8 on the penetration aspiration scale, indicating that material entered the airway, passed below the vocal folds, and no effort was made to eject the material. There we go. So based off of Opie's patient medical history, complaints, and swallow study, we chose these treatment approaches to increase strength, increase stimulation, and protect the airway. These will all be trialed during the reevaluation next week to see which seems appropriate for him. We are choosing to wait until 1 week to trial these once Opie's pneumonia has been taken care of and that we followed up with the primary care physician about his medication changes. At this time, there are a few different exercises, compensatory skills, and dietary changes we would like to trial. Due to the instances of penetration and aspiration, we would like to slightly thicken his liquid to nectar only until Opie is able to fight off this infection. We will discuss with the registered dietitian to ensure that Opie is getting enough liquid per day to stay hydrated during this short period of time. We are choosing to do this because during the video fluoroscopy, we observed instances of penetration and aspiration with the thin liquids, and we would like to reduce these instances so that Opie's infection can be eliminated. Also, considering that Opie has an allergy to the antibiotic sulfa, we would like to lessen the chances of the pneumonia worsening. Once Opie comes back to the office for the reevaluation and we hear from the PCP, we will begin to implement some compensatory strategies to see which works best for Opie. One approach is the Misako maneuver to strengthen both tongue-based posterior movement and anterior pharyngeal movement. We will teach him the process of holding his tongue gently but firmly between the central incisors so that a fourth of his tongue is extended. Another approach that we would like to try is the supraglottic swallow. We want to try this because it is a technique that protects the airway and also strengthens the tongue pressure produced by the contact between the tongue and hard palate during the swallow. This technique is used to close the airway before swallowing. We would teach Opie to hold his breath before swallowing and then to cough immediately after to clear any residual food or liquid from the airway entrance. The last compensatory strategy we would like to implement on Opie is the effortful swallow to improve the contact between the base of tongue and the posterior pharyngeal wall during the swallow, thus increasing pressure on the bolus. We would teach him to squeeze hard with all his muscles when he swallows. This is to elicit increased oral and pharyngeal muscle involvement. Lastly, if we still see a pharyngeal sensation deficits and the pneumonia has been treated, we would like to have Opie try a carbonated beverage and see if this increases Opie's sensation. We would carbonate the bolus by either using an Alka-Seltzer or sodium bicarbonate tablet in a cold beverage and have Opie swallow about half a teaspoon. We want to try this because it has been found that swallows of carbonated material result in a faster triggering of the pharyngeal swallow. This is one of Opie's more concerning components in the swallow study, so we're hoping that this works for him and that he can remain hydrated and feel more comfortable taking in thin liquids such as water. We are thinking of the following recommendations that will be important to manage his current difficulties on the next slide.
Okay, so after meeting with Opie, our main focus is for him to recover from his pneumonia, increase his nutritional status, and eliminate his risk for aspiration. We want to treat Opie as a whole, not just Opie's dysphagia, which means we want to consider everything that is impacting him. We would look to consult with a registered dietitian to address his malnutrition and dehydration. We recommend that Opie follow a meal plan developed by the registered dietitian to maintain a healthy diet and to increase his caloric intake. Opie should track water intake to ensure adequacy and hydration. During mealtime, in order to ensure Opie is able to safely swallow, Opie should use nectar thick liquids and practice a safe supraglottic swallow. Additionally, we recommend that Opie monitor his oxygen saturation levels during mealtime. Since Opie has COPD, asthma, and currently has pneumonia, we want to ensure that he is receiving enough oxygen during mealtime. Research has found that patients that supported their oxygen levels during mealtime were at less of a risk for aspiration. Therefore, Opie should ensure he's taking breaks from feeding to increase his oxygen should he need to. He can monitor this by using a pulse oximeter. Additionally, it is important that Opie increase his oral hygiene. Since he has a high neutrophil count, Opie's protection against oral bacteria is compromised, and he's at a greater risk for higher bacterial concentrations in his oral secretions and food boluses. Opie should brush his teeth and tongue 2 to 3 times a day and then use a mouthwash after brushing his teeth. Also, we want to consult with Dr. Hines after Opie's upcoming appointment and follow up with his primary care physician regarding his treatment for his pneumonia and the adjustments in his medication. Lastly, we will plan to see Opie next week to follow up with how he is feeling and ensure that we are appropriately meeting his needs. Overall, we want to help him meet his nutritional needs, recover from his pneumonia, and reduce his risk for aspiration. So that's Opie. And on the next slide, we have our references.
Thank you.